Welcome to the deep dive. We've all been there. That moment after a conversation when you wish you'd said something different.
Or maybe felt like you weren't heard at all.
Exactly. Or maybe you said, well, too much and it just came out wrong.
Mhm.
So today we're really digging into that feeling. We want to explore how one specific communication style assertiveness can really change those moments.
Yeah, figuring out what assertiveness truly means.
Right, especially when things get tricky. And, how it's different from just keeping quiet or, on the other hand, being aggressive.
And it's so important. Clear, calm, respectful communication is, well, it's fundamental, especially in fields like healthcare, for example, where professionals need it constantly with patients.
Definitely. It's about making sure everyone feels, safe and understood.
Exactly.
Okay, so let's dive into it then. What is assertiveness, really? Lots of us think we know, but maybe we struggle with it in practice. Where do people tend to get it wrong?
That's a really good starting point because it's more nuanced than just speaking your mind.
Right.
Fundamentally, assertiveness is expressing your thoughts, your needs clearly,
Yeah.
directly, but, and this is key, while also respecting the feelings and rights of the other person.
Okay. Respecting the other person too.
Yes, a huge pitfall is mixing it up with aggression. Aggressiveness, well, that's being rude, maybe forceful. It often upsets people. It's more about dominating.
Mm-hmm. Get in your way, maybe.
Kind of. And then the flip side is passivity. That's avoiding the conflict, maybe letting others decide for you, or just not saying what you think, even when it's important.
So, staying silent.
Yeah. True assertiveness, it's not about giving orders. It's not about winning. It's communication with clarity and empathy, even when it's tough.
Clarity and empathy. That's a great way to put it. Okay, let's make it real. How about a complicated scenario? Let's start with healthcare. Like you mentioned, the stakes are clear there.
Oh.
Imagine a patient is, well, nervous, and they're refusing to follow a really important instruction for a procedure. How do you handle that assertively? Not aggressively, not passively.
Right. So your aim isn't just to force them, it's to inform and invite understanding.
Okay.
So you calmly explain why it's important and then genuinely ask if they have questions or what they're worried about.
So you might say something like,
You could say, I understand you're nervous. Let me explain why this is necessary. And please tell me what's worrying you. It shows you respect their fear, but still gives the vital info.
that makes sense. It validates them, but still holds the line on what's needed. Okay, what about giving instructions more generally? Not necessarily in a crisis, but just clearly.
Yeah, you want polite, but firm language. Clear and direct.
Like,
Simple things like, please remove your necklace, please, for a scan, or please sit still during the scan. Just direct, respectful requests, no demanding tone, but no ambiguity either.
okay. And what if a patient seems confused, maybe scared of all the medical jargon?
Ah, yes. Then you simplify.
Oh,
Explain things kindly without overwhelming them with technical terms. Keep it straightforward and check they understand.
makes sense. Okay, one more tricky one. What if, after you've explained everything clearly, the patient just says no, flat out refuses a test or treatment?
That's tough. The absolute key there is to stay calm yourself. Don't get frustrated, even if you feel it.
Easier said than done sometimes.
Oh, absolutely. But you calmly re explain the risks one more time, perhaps. But if they still refuse, you have to respect their decision, their autonomy.
Even if you strongly disagree.
Even then, you document it, of course, but you respect your choice. It really brings up that big question, doesn't it? How do you balance giving your professional advice with respecting someone's right to choose?
Yeah, that's a constant balancing act, I
It
imagine.
really is. But assertiveness helps navigate that
Right.
because ultimately being assertive helps both people feel safer and more respected.
Right. It builds trust, reduces misunderstanding.
Exactly. People know their voice matters even if you don't end up agreeing on everything.
So, thinking about this for you, our listener, what does this all mean? This clarity, this empathy, setting boundaries. It's not just for doctors or specific jobs, right?
Not at all.
These skills, they can genuinely change your daily interactions at work, at home, anywhere. Finding that sort of confident, clear voice that honors you and the other person.
It's universally applicable.
So, as you go about your week, maybe reflect on this. What stands out to you about these differences? Between being passive aggressive or assertive?
Hmm.
Where could you maybe practice being a bit more assertive, without tipping into aggression or falling back into silence?
And just remember, assertiveness is always, always about clear communication grounded in respect, even when the message is difficult, even when it's a no, or when you need to state a boundary firmly.
That respect piece is crucial.
It really is. Approaching things with that mindset is just, well, it's powerful.
Yeah.
And there's always more to learn about how we connect, how we communicate. But this is a really vital part of it.